and the recording will be shared with all registrants after today. We'll also include in that email any links or materials that you share in the chat box, so please feel free to drop things that might be useful to this audience. We are putting this on today with the support of SAMHSA and the Opioid Response Network. So thank you to our partners at AAAP for their support of this project. You are welcome to put, oh, the sun is not hitting well. You are welcome to put questions in the chat box or to use the Q&A function within Zoom. We will keep track of questions that come through during the presentation, and we'll hold most of them until after going through the presentation, but Monique and Joy may respond to things as they come up. So please feel free again to chime in. I'm going to mute somebody, please. If you would please keep muted throughout the presentation. You'll also have an opportunity during the discussion and Q&A to come off mute if you prefer to participate that way. And with that, I am going to turn it over to Joy Rucker, co-director of the National Black Harm Reduction Network, and her colleague Monique Tula, principal at Cadence Coaching and Consulting. And we look forward to hearing from you. Thank you.
Thank you. Welcome, everyone. Thank you for taking time out of your day to come and listen to us about our exciting project that we are getting ready to roll out in a few months, and a little bit about the National Black Harm Reduction Network. So today we're going to be talking about our project and its roots to resilience. And it's really about workforce development training and a TA overview. So I'm Joy Rucker. I'm the co-director of the National Black Harm Reduction Network. Monique?
Everyone, I'm Monique Tula. I am a coach and consultant. I just launched my new consulting firm called Cadence Coaching and Consulting. I'm really happy to be here. Joy and I go back a long way, and I know some of the folks on the call, so it's nice to see some of your faces after a long hiatus. Before we get started, I just want to give NASTAD, specifically Lily and Juan, a shout out. But also, I want to acknowledge the land that we're on, and we're in these virtual sort of liminal spaces, and I think it's still important for us to recognize that the Indigenous folks who have lived on and cared for the lands that we occupy for generations, right? So it's just an acknowledgement to honor their resilience, their sovereignty, and the deep history of the land. So if folks could just take a moment to reflect where you are joining from today. I personally occupy the land of the Pyote-Cowichan, now known as San Diego County. You may be on ancestral lands of the Lenape, the Duwamish, the Choctaw, or countless other nations whose stewardship predates colonization. And this is important especially to recognize because of the work that we're going to be talking about today. So whether it's about justice or harm reduction or healing in general, this directly relates to the legacy of colonialism that continues to impact Indigenous folks across this country and around the world. And I think it's especially important to recognize that today.
Thanks, Monique. And also on that line, whenever Native American people open up their ceremonies, they always acknowledge the ancestors. And in African American culture, we acknowledge our ancestors as well and ask them to come into the room to guide us in our work. So.
Joy, just tell me when you're ready for me to shift the slide. I'm happy to do that.
Shift the slide. Okay, American drug policy has always been about race. From the beginning of time, it's always been about race. If you look back at all the drug laws and what has been put in place from the beginning, starting with the Chinese folks, with the opium, smoking opium, that it is always about a punitive process for people of another race that use drugs. Next. So we have decided that reducing harm isn't enough. It must be eliminated. And our mission is dedicated to advancing harm reduction principles that optimize health and wellness for Black people who are disproportionately harmed by public health, criminal, legal system, and drug policies. Our vision, we believe that simply avoiding or reducing the effect of structural racism manifesting as criminalization of substance use and mental illness stops short of our mandate as Black harm reductionists. And we believe that it goes beyond drug use. Next. So these are the pillars in which we work with that guide us in our work. Advocacy and policy, be the national voice that advocates for Black central, federal, and state public health, criminal legal system, and drug policies. Network building, support regional networks of Black-led and Black-centered harm reduction initiatives. Subject matter expertise, provide technical assistance on substance use and intersecting issues to community-based organizations and government entities. Technical assistance provides supportive, sustainable mentorship and TA to Black harm reductionists. And our pillars came from our membership. We have met over the years at different conferences, and we've asked the membership, what do they think are the most important things that we need to focus in on? And this is part of how we got to our pillars. Next. From roots to resilience, NBR, National Black Harm Reduction Network, you're right, it doesn't roll off. Workforce and development, mentorship program for Black harm reductionists. So you might be saying, why are we developing this for Black harm reductionists? So you can go to the next slide, Monique. Because it's flexible and culturally affirming workforce and mentorship program that is culturally affirming and deeply rooted in the experiences and historical context of Black harm reduction. The training curriculum prioritizes skill building, but also connection to ancestral practices while working toward addressing systematic barriers. And why we're taking this approach is we realize that the current state of harm reduction and how it's being practiced is not working in the African American and Native American community. And there's something very, there's a nuance that's missing, and it's a cultural aspect. And we believe that if we start to define what is it that brings our culture together to reduce harm in a way that's familiar to everyone, instead of just focusing out on drugs, that we will have a better outcome in reducing the harm in our community.
Yeah, and thanks, Joy. And so the whole idea here is to cultivate the next generation of Black harm reduction leaders, right? NBHRN was formed. It's a bold, unapologetic action that's informed by Black experiences and leadership, right? The truth, why is this important now? Harm reduction is at a critical crossroads, right? So a lot of the folks, some of the trailblazers who dedicated decades to this work are beginning to transition out of the field. We're losing folks. That's just the truth, right? And these are people who built the foundation of harm reduction in Black communities. These are folks who learned early on how to navigate systemic barriers, right? These are folks who really were on the ground level of creating spaces of health, dignity, and safety, despite all of these immense changes. So as that transition is happening, the torch has to be passed to someone, right? And so this is a moment that calls for intentional investment in developing leaders who are ready to step into these roles, but want to build their skills. It helps to ensure the evolution of harm reduction, but that it remains rooted in equity and justice. And that need is particularly urgent in Black communities as we continue to face disproportionately high rates of harm from systemic racism, the opioid crisis, the criminal legal system. So without dedicated Black leadership, we really risk losing the cultural relevance and community trust and innovative approaches that have been integrated into harm reduction organizations and practices all around the country.
The other thing that we've learned from our membership in communities is that people in African American communities, first of all, they're not monolithic, so we're not all the same, but certainly there is the question that we're asked is, why harm reduction now? Why overdose prevention now? Where were you when the crack epidemic was happening? And so for us, we understand that there has to be a healing process in our community still from the crack epidemic. And then we can talk about really the impact of the overdoses that are happening in our community and why we have disproportionately high numbers. So defining Black in the context of R2R. For this program, Black refers to specifically to those navigating unique history of racial discrimination in the U.S., including descendants of enslaved Africans and those whose identities have been shaped by the legacy of systematic oppression. We understand Blackness is not monolithic and celebrate the diversity of Black cultures and history and experiences. Who are Black harm reductionists? For this program, we consider Black harm reductionists to be folks who identify as Black within the context of the African diaspora. They are committed to supporting Black people who use drugs while providing services that center their health, dignity, safety, and work in a range of settings, including syringe exchanges, reentry programs, HIV and hepatitis C prevention, and community-based organizations, community-based health organizations. So we're not just going to focus in on syringe exchanges. We know that not all drug users go to syringe exchanges, especially in Black communities where smoking is a big issue. And people always think that going to a syringe exchange means you can only get syringes, and they don't know that at some syringe exchanges you can get safer smoking equipment. Next.
So there are some themes and values that we want to imbue in the curriculum that we're developing. So we want to prioritize continuous learning and development, making sure that folks are growing not just professionally, but also personally. I think it's really easy to note that workplaces we're in the midst of a shifting workplace paradigm, where folks are expected to show up as their whole selves, but then there's some resistance to doing that. People should be able to define what whole self actually means, not necessarily bringing every aspect of their lives into the workplace. So what we're hoping to do is equip participants with the tools and confidence that they need to make impactful decisions, advocate for their communities, but also maintain a healthy work-life balance, right? This curriculum is going to celebrate Black culture, centering the unique experiences and histories of Black harm reductionists. But really, this piece about prioritizing wellness can ensure that leaders thrive, right? Not just survive. And then also, we're looking to develop leaders who are not just skilled, but really deeply rooted in justice, compassion, and accountability. So there are 4 key knowledge areas. The basics of harm reduction will be one of them. Providing folks with an understanding of the historical and cultural context with regard to Black folks and substance use in the US. There will be a leadership development component as well as an advocacy component. And we intend on integrating culturally responsive practices. And so what do I mean by that? So centering community in everything that we do, recognizing that for collective progress to advance, it requires collective effort. Ancestral practices. So by connecting folks to ancestral wisdom, we honor the resilience and ingenuity of people who came before us. A holistic approach, meaning that we see leadership as a whole person endeavor, integrating emotional and spiritual and professional dimensions into the trainings. Healing. Our program recognizes that trauma, the trauma that many Black harm reductionists face. And then peer equity. So we really want to foster an environment where knowledge is shared, that everybody's voice carries equal weight, and that it reflects the collective spirit of harm reduction. And so the way that we'll do this is we will have workshops that are topic-based, and I'll get to that in just a second, but we are creating a mentorship and coaching structure that's designed to foster growth and connection and sustainability for emerging Black harm reduction leaders. So the idea is that it would be some, in terms of mentorship pairing, these are intentional pairings. So each person would be thoughtfully paired with a mentor based on their shared experiences, goals, and areas of expertise. The role of the mentor in this case, these would be folks who are, I don't know, seasoned Black harm reductionists. That feels like an appropriate label. Seasoned Black harm reductionists who provide guidance, but share lessons from their own journeys. And so these are not necessarily folks who are coaching, but because coaching is a very specific kind of thing, we will offer that as well. But mentorship is really making sure that folks are connected to other people who have deep subject matter expertise, so you can sit down over coffee or in some kind of virtual space and just pick somebody's brain based on their experiences, lessons from their own journeys. And so we're hoping that this will build relationships between, within the generations, right? So one-on-one relationships creates this space for people to be able to ask questions, safely explore challenges, but also just build their confidence. And then we'll also have group mentorship sessions. And so the idea here is, again, this is about the collective. We're not doing this on our own, but we're hoping, for people to be able to share their experiences and learn collaboratively. The sessions will address key issues such as systemic racism, leadership strategies, and self-care. And this is actually something that I have a little bit of experience with before I left the National Harm Reduction Coalition. One of the things that we did was launch an executive director mentorship group, and we met once a week, and it happened, this was right as COVID was hitting. So it was in early 2020. And it was just a place for executive directors to just get together and talk about what they were experiencing in their own organizations as, the whole world sort of exploded, right? But people had a really great response to that and wanted to see it continue. It might still be happening. I don't know. But what we'll do here, say again?
It is still happening.
Awesome.
I facilitate that group.
Awesome. And so we'll use the same sort of model where we're but gathering folks who are interested in being mentored by seasoned Black harm reductionists. And then I mentioned individual coaching. So the idea here is to foster an environment of personalized support through coaching so that folks can set goals, reflect on their progress, and address specific challenges. So I'm going to pause here. And actually, Lily and Juan, we didn't say if we were going to take questions during the presentation, but I just want to pause to see if anybody has any questions. Or do you want us, Lily, for folks to wait until afterwards?
I'm happy for people to chime in if anyone's got questions.
Okay. And if not, we'll keep it pushing.
I do have a question. Hi, my name is Janetta White. I work with King County Public Health as a education specialist for the overdose prevention and response training. I've been there for since August. Okay. And my question is for a person in my position who may think they have something to offer to this, but doesn't have lived experience per se, or any harm reductionist experience. What do you, sounds like this may not be quite for me. I'm just not sure. Before we I stay and we go any further, I just wanted to ask that question. What do you think?
Well, you'd have to tell us what your expertise is. I mean, I'm not sure what you're so.
Okay, so yeah, that's a good question. So I would say I'm an expert in coordinating services. I worked at Therapeutic Health Services for 20 years, starting out at the Youth and Family branch, which was originally Central Youth and Family Services in Seattle. And I did a lot of I was the intake specialist, the intake coordinator, and those types of things. I helped out with groups and trainings, but trainings of staff, which is also what I'm doing now, is training staff and train the trainers on overdose prevention, specifically of opioids.
I don't know, it sounds like harm reduction to me.
Me, that is harm reduction.
You know, and I think the whole thing is that well, Joy sort of mentioned Black in the context of this program, but also what are Black harm reductionists? And we really want folks to think expansively, right?
Mhm.
If you have an interest in ensuring that Black people who use drugs and Black communities that have been impacted by substance use um, are well cared for, that are seen, that you have an interest in understanding the historical context of substance use in Black communities, that you want to develop leadership specifically as it relates to harm reduction and Black harm reduction even more specifically, then this could be for you. And we're going to talk a little bit about what the application process looks like, and then that may help further inform your decision. Okay. A few of the topics that we'll be exploring include case studies of Black-led responses to substance use disorders. And so, again, we want people to think expansively about that. There's definitely, the current work that's happening, like Women with a Vision, for example, comes to mind. They're doing amazing work in New Orleans and have been. But also historically, there were groups that you wouldn't necessarily think were practicing harm reduction, but were, like the Black Panthers and the food programs and the free food programs and health programs that they started. So we want to be able to see like harm reduction as a through line that is connecting all of these practices that Black folks have been using for years and years, right? But we'll also explore, the impact of systemic racism, promoting self-care and harm reduction, disparities in substance use, treatment, and then, no training is, we also want to make sure that people have an understanding of what the current data is and how to use it in their programs. So about the application process. So it's really designed to help applicants articulate your unique contribution and your readiness to step into leadership roles in harm reduction. And so we want applicants to share their stories. So Janetta, you have a story. And if you're interested in this program, then we want you to be able to articulate how the work that you've done aligns with advancing equity and supporting Black communities. To make it accessible, we're going to host an info session for potential applicants so we'll walk you through the application and then answer any questions that may come up for you. We're also exploring additional ways to support applicants, like providing one-on-one guidance to ensure that this opportunity reaches the folks who need it the most. And then we have a call to action for health departments. So we're really counting on your membership to share this opportunity with your grantees, especially those who are emerging Black leaders in harm reduction. It's really your support is really key to ensuring that this program reaches the folks who are going to benefit it the most and continue transforming harm reduction work. So there's a few components to the application process. Again, we want people to share their stories. So a 500-word or less personal statement where you can talk a little bit about your personal journey, and professional journey, what your motivations are, any aspirations that you might have to move further into harm reduction or leadership. So this would be like your opportunity to talk about why you're passionate about this work, why you are inspired by this work, and how you see yourself contributing to harm reduction leadership. And then we also want to hear a little bit about what's your, connection to the community and what kind of impact that you want to see in your community around addressing substance use issues. And then lastly, how does your work support Black communities? How does it foster equity? How does it align with harm reduction principles? And again, you don't have to necessarily be working in harm reduction. If you are interested in working in harm reduction, specifically in Black communities, then this could be the program for you.
And, we want to be clear that people that work in reentry programs, community health clinics, uh, any person that provides a, a quality, ways for people to have a quality of life is reducing harm. So you could be working in housing, you could be in the hospital working as a peer connector. It's not just focused on syringe exchanges and providing kits and resources in that manner. So we know that in our community, we practice harm reduction in a lot of different ways.
Yeah, and I'm just looking at a question in the chat about NASEN and National Harm Reduction Coalition being helpful to this to this discussion. Can the person, oh, in terms of harm reduction resources, dollars, startup kits, just wondering.
I mean, yeah, I saw that. The harm reduction, the national harm reduction, well, Monique, you could talk better about that, but NASEN, we're not talking about starting syringe exchanges. And, unless people are specific that they want to provide, start a syringe exchange, then that's some TA that we could provide, but it's not specifically about this project. And Eileen has put our information email in the chat.
Jose, you have a question?
Yes. So considering I was a little hesitant when I received the invitation to participate in this webinar, recognizing that this is put together by the National Black Harm Reduction Network, and not being a Black person, but working in harm reduction and touching the Black population that it's impacted by substance use, and also recognizing the limitations of my culture compared to the culture of Black people. The question is this program open to people who do not identify or are not Black people who work in the field and work with Black communities?
Well, I guess, our question would be, if you're working with Black communities, why do you have Black people on your staff?
Not at this time.
Okay, so that's another question for us, and that's why the Black Harm Reduction Network has been created, because we know the majority of harm reduction programs are not led by Black people, but serve Black people. And so we want to help peers and outreach workers that want to be involved in this work to gain the skills and the knowledge they need to be able to work in harm reduction programs. So that's really who this is geared for, because we know. We know.
Yeah, definitely. And unfortunately, I said unfortunately not at this time, but in the past we have had Black folks in our team. thankfully, they have moved to bigger things, and they have now moved to leadership positions, not within our program, but outside of our program, right? Okay, that answers my question. Thank you.
Thank you.
The other thing I just thank you, Jose, that was a really good question. And you know, we certainly, while we are centering Black folks, you know, we're also not discriminating. If people have a real interest in learning more about this work, then, you know, apply and talk about why that is, and maybe some of the changes that you want to see in your own institution and community. So yeah, just putting that out there. Also, I want to answer Brian's question in terms of, is there more information on the program that's published somewhere? We are currently in the middle of developing it. So once we're done, I'm going to talk about the timeline in a second. We'll have it posted on NBHRN's new and beautiful website. Yay! Yes, Mary, the website is amazing. It's gorgeous. All right, so what is happening with my cursor?
I want to just piggyback on what Monique said. We're trying to be inclusive, and we're trying to build the bench. And so it really is, we know that there are a number of people that work in this field that have Black staff and or work with Black participants that would benefit from this kind of mentorship and peer development and training and coaching. So we are inclusive.
Okay, so this is the timeline. So we intend for applications, the application process to launch in January, sometime in January. And we'll have an info session that details what the application process looks like and any support later on in that month. We're going to give people about 30 days to fill out, you know, to work on their applications and submit it. And then we'll do a cursory review to make sure that everybody, you know, that the applications meet all of the eligibility criteria. And then we also will be pulling together a group of people to review the application. So it's not just on Joy and Tracy to review them, but actually a group of folks who will be the the application committee. And then in March, final decisions will be announced, and we anticipate launching the training in April sometime. So that'll just give you a little bit of it gives us plenty of room to make adjustments to the curriculum based on the applications that come in, but also real talk. I mean, the world is changing once again based on the outcome of last week's election. And so there may be things that we want to adjust or developments, you know, that need to be things that we want to adjust based on that development. So, again, we have a call to action for health departments and any organizations, community-based organizations that are on the call right now. If you can help share the opportunity widely. Eileen is on the call today. Eileen is one of the staff of the National Black Harm Reduction Coalition. And so we'll create a flyer that can be sent out to folks. And I think that it's okay to share this slide deck with people. Yeah, Joy, are you okay with that?
Yes.
Okay. Yeah. So if you can help spread the word with your grantees and encourage people to at least attend the info session in January. And then before the deadlines, if you could offer reminders to the grantees about the submission timeline. And then after the application process, post deadline, if you just stay engaged with us and help us inform the development of this curriculum. It's important. We've never had one before that is geared toward Black harm reductionists. And so, you know, if you're gathering information from your grantees, if there are things that are coming up that you all know of, it would be helpful as we design the curriculum itself.
And particularly for health departments, if you are contracting with community-based organizations that are small, Black, struggling organizations, this is a great way to support them. Send them to the training. We can provide TA for them. That's our whole goal, is to strengthen smaller agencies, and so that they're able to be much more effective and reach a wider range of people in the community.
All right, so I want to open it up for any other questions that folks might have. Comments, ideas, suggestions? Ryan, it's so nice to see you. It's so nice to see you.
I can't wait to share this with staff here in my department. So I'm really excited about this opportunity for them.
Ryan, where are you now?
I work at Lifelong Medical Care in Oakland and Berkeley, and I run our homeless services department. So we have, you know, street teams, primary care clinic, medical respite, supportive housing. So a lot of really good folks who I think would really appreciate participating in this.
Do you know Makeda?
Do I? Oh yeah. Uh-huh. Yeah. So Makeda works in the supportive housing program in my department. Our offices are right next to each other.
All right, I'm picking her up from the airport tonight.
Oh, awesome. Well, I'll talk to her about you then when I see her tomorrow.
Okay.
There's a question in the chat about a cost to attend. To be honest with you, it really depends on how much support we can raise. And so if we can get some funding to support rolling out the workshops, that would, you know, essentially pay for the people who would be facilitating the workshops, then the cost would be reduced. So more to come there. And we're thinking, Mary, thank you for that question. I think somebody else, we're thinking that the program would be between 3 and 6 months. It really depends on the pool of facilitators that we pull together to help facilitate some of the specific topic areas. And also just wanted to note, and I should have put this in the deck, that this is a sort of a pilot program. And so if you think of this as we're sort of beta-ing this curriculum once it's been developed and gathering information and lots of feedback all along the way so that we can make improvements.
And we will also do assessments of the folks that we put in a cohort on what are the most pressing issues for them to be addressed. And so it's, you know, there'll be structural things like organizational development, budgets. How do you, if you're in that position, how do you create that? So there'll be some concrete organizational information as well, but we will assess what folks are saying their biggest need is.
History in the making. Yeah. I think so. Yeah.
There is.
Any other questions or anything else we can help clarify for folks?
Hi, I'm Cameron Peak. I am the new overdose prevention coordinator for Harm Reduction Sisters. I'm a Black woman. Let me put my video up. I don't know if y'all can see me.
Hi, Cameron.
Hi. So
Welcome.
I'm a new harm reduction overdose prevention coordinator for Harm Reduction Sisters. It's a Black led initiative. I do have 11 counties, I believe. My farthest one south. We're based in Duluth. My farthest one south is Pine County. I did reach out to you guys about a mentorship program, a mentor possibility. So I think this pretty much answers my questions. But so I would have to sign up or try to apply to become selective a part of this cohort, is what I'm just understanding.
Yeah,
And
yeah.
yeah, we don't really see us turning away folks. We really want to be make this as low barrier and inclusive as we can.
And this is like a first peek. Again, I just hats off to Lily at NASTAD for helping to champion this through the channels at NASTAD. If it weren't for them, really, we wouldn't even have the curriculum outline. We do have the curriculum outline and are now just sort of filling in the gaps. So really big ups to Lily and the team at NASTAD. And then also, can I just do a little shameless plug for
Go
Cadence
ahead.
Coaching, Cadence Coaching and Consulting. So I just launched this organization, this consulting firm. And so I bring like 30 years of experience in harm reduction and public health spaces, and am also doing one-on-one coaching now. So if you know of folks who might be interested in doing some coaching, both personal and professional coaching, I'm raising my hand. I'd love to do some work with people. And harm reduction is always going to have a sort of a little bit of a soft, tender spot in my heart. So please do reach out in case anybody might be interested in individual and group coaching.
Any more questions, comments?
All right.
Well,
Well,
thank you for your time. We really appreciate the opportunity to showcase what we're getting ready to do, and hope you all can be involved in any way that makes sense for your community. Thank you.
thanks, everyone.
You covered it all. Thank you so much. So this recording will come out to anyone who registered. You're obviously welcome to share the recording and links with other colleagues and contacts who might benefit from learning about the mentorship program. Juan is going to come on in just 1 second and give everybody a link to an evaluation survey. And please reach out to Drug User Health TA at nastad.org if you're not on the listserv and want to be, or if you've got any follow-up questions. Thank you so much. Take it away, Juan.
Hello, I really only have one quick little thing. I'm posting the link in the chat. If y'all want to tell our funders how awesome and wonderful the work that Joy and Monique are doing is, so that they'll give them more money to do it,
Yes.
this is the way to do so. Thank you very much.
Thanks, everybody. Thank you, Joy. Thank you, Monique.
Bye, guys. It was great.
Bye.
See ya.
See you soon.
Hey, Bree.